Hi friends, I hope you all are doing great. Let's discuss today's topic. So today's topic is respiratory failure. There are 4 types of respiratory failure. Type 1 is hypoxemic respiratory failure due to the decrease in the partial pressure of oxygen in the blood. Type 2 is hypercapnic respiratory failure. Type 3 is in the surgical patient. Type 4 is in the shock patient. Right? Type 3 and type 4 is not much important. Only 1-2 points are important in type 3 and type 4. In type 3 respiratory failure, in surgical patient, whenever general anesthesia is given, that may lead to the lung collapse, that will lead to the respiratory failure. Okay. Type 4, in the shock patient, hypoperfusion of the respiratory muscles will occur, that will lead to the respiratory failure. Okay, so we will discuss regarding type 1 and type 2 in much detail. So this loop, this cycle is very important, or we have to clearly understand this loop, because by understanding this we can clearly know the causes of respiratory failure as well as the difference between the type 1 and type 2 respiratory failure. Right, so brainstem will control the respiratory cycle by the spinal cord by peripheral nerve relaying the neuromuscular junction, and the muscles that will control the respiratory cycle by alveoli along with the bony rib cage. All this will maintain our blood pH along with CO2 and the blood oxygen level, right? And that will, via the feedback loop, will control the respiratory center in the brainstem. Okay, so any of the disturbance in the brainstem or the spinal cord or in the peripheral nerve or in the NMJ or muscle disorder or in the disorder of bony rib cage and the alveoli will lead to the disturbance in the blood pH and partial pressure of CO2 and oxygen, that will lead to the respiratory failure. So let's understand the causes of the respiratory failure. So brainstem disorder like the central hypoventilation syndrome will lead to the respiratory failure. Spinal cord disorder like the amyotrophic lateral sclerosis like the transverse myelitis. Peripheral nerve disorder like the Guillain-Barré syndrome. NMJ disorder like the myasthenia gravis, Lambert-Eaton syndrome, botulinum toxin, and OP poisoning, and lot of causes in the muscles, myopathies in the alveolar disorder like the ARDS, pneumonia, and interstitial lung disease. In the bony rib cage disorder, we can write here the bony rib cage, right? Bony rib cage also. Okay, so ankylosing spondylitis and pleura also included here also. Pleura is like fibrothorax. All this will condition will lead to the respiratory failure. Okay, I hope this has been very clear to you, right? So please keep in mind. So type 1 respiratory failure, what was the primary event in the type 1 respiratory failure? That is hypoxemia, decrease in the partial pressure of oxygen in the blood, that will lead to the increase in the respiratory rate or tachypnea. So tachypnea will lead to the CO2 washout. Whenever CO2 washout will occur, it will lead to the respiratory alkalosis, that is decrease in the partial pressure of CO2. So these two factors are important. Please don't be confused ki what happened to the partial pressure of oxygen, what happened to the CO2. Just keep in mind the fact that type 1 respiratory failure is the hypoxemic respiratory failure. Type 2 is the hypercapnic respiratory failure, and by understanding this loop, you can understand everything basically regarding the respiratory failure. Okay, so what happened in type 2 respiratory failure? CO2 retention will occur and increase in the partial pressure of CO2. As the respiratory compensatory tachypnea is not occurring in this patient, that will lead to the decrease in partial pressure of oxygen also. So why the compensatory tachypnea is not occurring in type 2 respiratory failure? Because the causes of type 2 respiratory failure mainly involve this part of the loop, right? This part of the loop is involved in the type 2 respiratory failure. So pay So patient is not able to compensate via increase in the respiratory rate, and that will lead to the CO2 retention, and that will lead to the respiratory acidosis. Okay, so type 2 respiratory failure is respiratory. What happen in this? Respiratory acidosis will occur. Okay, and here what will occur? Respiratory alkalosis. Right. So I hope it is very easy and clear. Right. So please keep in mind this diagram. Very important, because all the causes and what is the basis of difference between the type 1 and type 2 respiratory failure is very much clear here. We can, one thing is type 1, this portion is involved in the type 1 respiratory failure, right? So again, just keep in mind these two things. Type 3, type 4, only these 1-2 point surgical patient in the shock patient. Type 1 is hypoxemic, type 2 is hypercapnic, and this loop, and the cause is respiratory alkalosis in type 1, and type 2 is the respiratory acidosis. Okay, so thank you guys. One thing is that I am very new to YouTube, so I make all the efforts to discuss all the topics whichever I thought yes, I can discuss with you. So kindly appreciate my efforts, and please subscribe to my channel if you think that that will contribute to your knowledge in any way or your motivation, and please share with your friends also. Kindly keep motivate you also and me also. Thank you.